So thank you for joining us today at this special religious leaders gathering to look at some of the protocols for the reopening of faith communities, knowing of course that our faith communities have been open this entire time, but the facilities haven't. So thank you for joining us for this special religious leaders gathering. And we're going to start with a brief reflection from His Holiness John O'Donohue, who was a favorite writer of mine, was a Roman Catholic priest who specialized in Celtic spirituality. And this is from his final book called The Space Between Us, and it's a poem called For Equilibrium. So I think all of us are looking for a new sense of equilibrium during this time, not only because of obviously the coronavirus, but also as we seek racial justice throughout our country and the world. So read the reading, and then we'll have a minute of silence afterwards. For equilibrium. Like the joy of the sea coming home to shore, may the relief of laughter rinse through your soul. As the wind loves to call things to dance, may your gravity be lightened by grace. Like the dignity of moonlight restoring the earth, may your thoughts incline with reverence and respect. As water takes whatever shape it is in, so free may you be about who you become. As silence smiles on the other side of what's said, may your sense of irony bring perspective. As time remains free of all that it frames, may your mind stay clear of all it names. And may your prayer of listening deepen enough to hear in the depths the laughter of God. Thank you so much, everybody, for joining us today. And I invite everyone to, if you so feel inclined, in the bottom of your screen, in the middle is a button called chat. And then just invite you to take a moment to put into the chat your name and what your organization or faith community is, just so we can see who all's here through chat. I will join you in doing that. Such a blessing to have all of you here with us today. Thank you for joining us for this special edition of our a Marin Interfaith Council Religious Leaders Gathering. And thank you for being with us. Thank you for all that you do to make our community a place where everyone thrives and is welcome as people of faith. So thank you particularly for the exceptional ways in which you've found opportunities to create space for people to continue to be nurtured spiritually during this difficult time. And as we move through the pandemic, the County of Marin has now issued some guidelines for a gradual reopening of the county, including for faith-based organizations. So we have a speaker with us today who's going to talk us through that and to take all of your questions for what this might look like for your particular situation. So what I've asked us to do then is, again, for us to stand mute, and I'll introduce our speaker, and then she'll present, and then a chance for you to engage with her and ask all of your questions. So we're very pleased to have with us Chantel Walker, who is the Assistant Director of County Library Services at the Marin County Free Library. And she is also has been our lead for the working group of Marin Recovers for Faith-Based Organizations, and has done a fantastic job of leading us through this process of hearing the different perspectives and getting feedback not only from faith leaders around the county, but also resources from all around the country. So very grateful for her, for her expertise, her wisdom, her graciousness in leading this process. And she has an amazing background in all kinds of areas. She's also led the County of Marin's Organization Development and Training Division within the Department of Human Resources, delivering educational trainings, tools, strategies to build organizational capacity and employee excellence at the County of Marin. During more than 20 years of experience in philanthropy in the broader nonprofit sector, she has worked as a technical assistance provider, grant maker, senior executive, and direct service provider through the country, throughout the county on children, family, and neighborhood development issues. Published and presented on issues of early childhood education, community development, community organizing, the role of philanthropy, human services reform, and early childhood education, finance, and facilities development. Is fluent in Spanish and an experienced convener and facilitator. She continues to be an active and dedicated volunteer for family and community issues with several nonprofit organizations and public agencies. And she is also a member of Mount Tam United Methodist Church. And during her free time, she took on this assignment of leading Marin Recovers for Faith-Based Organizations. And so we're very grateful to have you with us today, Chantel, and thank you so much for leading us. And turn it over now to you.
Oh, thank you so much, Scott. And it's always, you know, in our Mutual Admiration Society here, Scott, it is always a pleasure to work with you. And I really appreciate the time and the access and the thoughtfulness and the resources that you shared to really help us make sure that we were able to move forward as faith communities at whatever level we could during the shelter in place and as we opened up. So what I will do is I will share my screen, and the screen that I'm sharing right now, or will be sharing in a moment, really is the Marin Recover site. So I'll say a few words about what that process was and where we landed as Marin Recovers. So Marin Recovers, believe it or not, was initiated as a framework for reopening and business sustainability and community engagement around the fires 2 Octobers ago. And in that moment, a number of communications people in Marin, in each of the government jurisdictions, really talked about the need to have a cohesive message and one place to go. The website and the group never made huge inroads beyond organizing themselves a bit. Once the shelter in place began and we saw the COVID-19 virus expanding, those folks came back together. The county of Marin became identified as sort of the keeper of the site that pulled together all kinds of jurisdictions as a way for people who lived in unincorporated county, who lived in the cities and towns, to really communicate with one another and to have as much clarity as possible. So as that was put together, the county then of Marin, working with multiple jurisdictions, began to think about what sectors were impacted by the shelter in place. With some guidance from the state and some local work, they were really able to think about a number of sectors that had rules and regulations that would be impacted and how to reopen those individually. So when the faith-based organizations group came together, it was inside this broader framework. The overall guiding piece that we're following is the state guidance on closure, though counties can be more restrictive than that broad state component. So for Marin, we actually, as a part of a set of Bay Area counties from Santa Clara up through us over to Alameda, really we're amongst the first to close down. The public health officers were working together and monitoring the growth of cases. And for a small place like Marin, you might wonder, we've at this point, we're about 725, 726 documented cases, and I believe 12 deaths. Given that we're 250,000 people, what triggered the closure for us, in addition to being in partnership with other counties that we touched? Well, our per thousand infection rate is high. So when they're looking at the rates, it's per thousand. I believe it was the 16th or the 17th that the county of Marin closed in March. And we began the reopening process in about middle May. Now, for Marin Recovers and the industry groups, one day I got a call from actually my director in the library, and we all do disaster service work. And she said, could you convene and facilitate the faith-based organizations group? And I thought, I could do that. Let me think about how to do that and who to call. And about the same time, the county put up on the Marin Recover site, hey, can a few people, let us know if you're interested in any of these industry groups. So we probably got 3 or 4 names there to pull together the group. And I called Scott and said, so I'm pulling together this group. We'd volunteered together in housing before and have known each other. So can you help me think about this? What are some things that I might be missing? Here's where we're going. And I asked him to join us also on the group. And so we ended up in this group, and I'll scroll down a little, with a cross-section of leaders. Those leaders were Protestant leaders, a leader from the Buddhist community, Islamic leaders, Jewish leaders, the Interfaith Council and Scott's leadership. And while we did not have a representative from each individual religious community or faith community, we really tried to make sure we had a cross-section of thoughts. In addition, when we came together, we brought a set of tools and resources. Scott sent some that he'd seen nationally. I did some research locally and nationally. We went to everyone that we could think of, including some insurance companies that insure faith communities, to get information on what they were thinking. And our charge as a group was to determine, as faith-based communities come together across a whole number of areas. I have much more experience in a Protestant and some experience with the Jewish community, but from a Protestant Methodist perspective, we were thinking about everything from how do you enter the church, how do you leave, what kind of spacing when you say 6 feet, how many square feet is that? From a more Islamic perspective, people brought up often at worship's not just one group, it's also 5 times a day, it's not once a week. People don't always have their shoes on. I mean, so the sharing of food, cultural activities. So we talked through those things and what we thought best practices were. There is an overall document that I think went out with this invitation called a site-specific protection plan. It's really about how an identified leader in a faith community or in any community or business will put together a plan of how people who enter that space will remain safe. Is it contact tracing? The next piece was really what we worked on. So if that's the plan, then there has to be kind of an appendix B, we used to call it. But it was really the second step of that is what might reopening look like? What are some of the elements? What are some things we'd have to change? What are some things we'd have to miss? And then we give that guidance, and our faith-based group gave that information to the county public health officer, who under the broad direction of the state can do certain things and can't, but can be much more conservative or much more safe given the environment than the state order. And so we gave that information to our public health officer, I think around the end of May. Scott, correct me if I'm wrong. And we were hoping that both the indoor and the outdoor guidelines that we were thinking about and working on would be able to move forward. At this time, given the virus and the rate of growth, or back in May, the virus and the rate of growth, the public health officer decided to allow faith-based organizations to open outdoors initially, because as you all may have been watching on the news and thinking about things like that, it is both the intensity of the contact, how long are we together as a group, and what kind of circulation and air movement is available to decrease the likelihood of transmission. So with those two parameters, we gave both indoor suggested guidelines and outdoor. The public health officer, as of June 6th, agreed to outdoor guidelines. And we expect as the shelter in place continues to ease, that indoor opening will be more likely, more available, and that some of those guidelines that we suggested will be picked up by more and more faith-based communities to apply to their celebrations, their cultural celebrations, their worship services. So where we are now as a county, there's some information on the Marin Recover site, which really speaks to when reopening will happen. But also, if you look at this landing page that we're on, it's marinrecovers.com, faith-based organizations. The public health order was modified, and that was shared with our team. And that's where I am here. And then the best practices that we talked about for faith-based and cultural ceremonies are in this second document. Each jurisdiction, meaning a county entity, lifts its guidelines on its own timeline. And one of the things that was noted by our public health officer is that Marin County, per 1,000 people, acts much more like the urbanized county, San Francisco below us, or Alameda next to us, than it does like its rural county partner to the north of Sonoma. So they're really looking at the science and the numbers. If a faith community were to say, so what are our next steps? Your first step would definitely be to go to this landing page, read it, see what's there, and then you would highlight the document that was sent out and really look through that document, think about your site, and write in how this site-specific plan applies to you and the activities that you conduct in your outdoor spaces. And at some point, you would update this plan for your indoor spaces. You then either post it on some accessible spot or you would have it available, you know, maybe on a front door or on an office door. And if transmission occurred at your site, you would then follow the protocols in that document to let county health officials know. So I think I'll stop there. Scott, unless you have specific questions for me, And then maybe you can help me proctor the chat a little bit. I can't quite see it with my screen up.
Sure, I'm very happy to do that. Do those of you who are, I guess we can do one of two ways. We can either just have you physically raise your hand, or you should also have a raise your hand button. If you look in the participant box, there should be a raise your hand, and you can virtually raise your hand, or if you'd rather like physically raise your hand, you can also do that. And I will try to scroll through folks. So Stephanie Ryder.
Yeah, thank you so much, Scott and Chantal, for providing this for us. And I know you had said from the start that you were going to provide information also regarding tenants. And I'm wondering where you are with that, and if that is somehow different or accessible. I know many of us at our churches and places of worship have Alcoholics Anonymous groups that meet of various sizes, and they're suddenly asking, you know, when can we come back? And so I'm just curious if we're, how and if we're affected by regulating our tenants as well. Thank you.
Yes, so thank you. Rental was a large part of our conversations as a group, the space rentals for the Alcoholics Anonymous groups and other groups. Two things surfaced. One, some of those activities, just like your staffing, you'd really want to look at general office space and the guidelines that are under that. You also want to take a look at because some of the ways that that's used is more like used as office space. The other thing is each of your tenants would need to fill out a site-specific plan to really understand how they would manage disease transmission or reduce the likelihood of disease transmission. So if, for example, some faith-based organizations were having folks stay overnight, we directed them to look at hotels and motels. For some of the tenants who are renting your space but are in one room with one set of people touching a certain group of chairs, you would want to have them fill out a site-specific plan, and then you would agree to, because it would be their responsibility to reduce disease transmission, and then you would agree to what components of the cleaning. So if you take a look at the site-specific plan, it talks about how different surfaces and areas will be cleaned. Either they clean those or they pay you to clean those. I hope that's helpful.
Extremely helpful. Thank you so much.
Chantal, is it okay if I turn off the screen view for a minute and we can see that?
Yes, definitely. Should I stop sharing? Is that the best way to? Okay, there we go.
So anyone else want to either virtually raise your hand or physically raise your hand with a question? Okay, Sharon and then Tom.
Yeah, what you just said was our understanding that our church would be the ones responsible for cleaning for if somebody, we rent to 2 other churches, and that we would be responsible and that they didn't have to pay us. Are you saying that, did I not understand that right?
So you could approach it as you don't have to pay us cost and we're responsible for the cleaning. It simply needs to be negotiated. And to the extent that someone, because often when AA meetings are held at a church site, even at my church site at Mount Tam, there isn't necessarily a member of the staff, the administration, or a volunteer on site. So someone needs to be from that group who was going to be present in that moment. If you choose to charge additional funds for that, we're not saying that you must, but if you choose to charge additional funds, you'd want to talk with the group about it.
Oh, okay, thank you.
Because these are more best practices than must-dos.
Tom, I think you had a question?
Sure. Actually, follow up and then another question. So, just to so I'm clear, so the groups, if we're treating them like using office space, they are allowed once we have the site-specific plan in place. They are allowed to meet in our facilities?
If it's like an office space meeting under the broader guidelines. So if you look at
Okay.
those guidelines, there's a square footage difference. So I'm not up on my screen, but there are
That's
guidelines for
okay.
how many people in a space.
I posted the general office space guidelines in the chat, the link to it.
Thank you. Now, the other question is, we're starting to think about outdoor worship in August. And at this point, we're wondering what the best practices or most safe practices might be regarding singing and speaking.
So we talked some about that, and I believe it's in the best practices there. So the best
Okay.
practice that we described was most people have their faces covered,
Mm-hmm.
except the primary speaker or worship leader.
Mm-hmm.
That we would want to discourage lots of people being together, right? So people would sit in family groups, and that to the extent possible, you're not trying to project your voice a lot, which is a constraint on the way a number of us worship.
Mm-hmm.
But most people with faces covered most of the time, and then a person at the front who's more distant, which in a number of the worship setups works out well, would not have their face covered.
Okay.
No shared microphones. We discourage the sharing of, and I'm thinking about this because of my experience in a Protestant context, but no sharing of songbooks,
Mm-hmm.
no sharing of things along those lines. You know, one idea is we suggested putting online the bulletin or the program that people sometimes distribute, that people have it in advance and you're not passing paper and collecting paper. We suggested projection of lyrics if there is singing or reading, and that you're not projecting your voice, but that you have a screen up. And so these are best practices. No one's going to come by, or in general, I won't say no one. It's highly unlikely that anyone's going to come by to monitor your service, but you do have requirements should there be transmission of disease, and
Mm-hmm.
requirements to use defendable practices to keep people healthy.
Right. I mean, that's obviously, we just want to make
Yeah.
sure we're providing the most healthy experience, worship experience that we can. So
And we
thank
also
you.
encouraged, oh, no problem. And we also encourage things like maintaining, many people have been doing online gatherings, maintaining those for people who are vulnerable, reducing the size of services, adding more, you know, things like that.
Thank you.
And all of these things were in the document that was included in the invitation, the Zoom invitation. If you look, there are links, and there was one that had the health order, and that has all of these details that
Okay.
again are best practices.
Thank you.
Darwin, I think you were next.
Hi, this is Dr. Darwin Labarth. I'm affiliated with St. John's Episcopal Church in Ross and part of an advisory group anticipating opening at some point in the future for outdoor services. One of the things that we are trying to do is anticipate what will be the procedure in the event that a case of COVID-19 is identified within the congregation, either related to attendance at a service or otherwise. There's a great deal of emphasis, very appropriately, on case documentation and contact tracing. We know that Marin HHS has been developing capacity for contact tracing. And our question is, how much can we rely upon the capacity and resources of Marin HHS to assist in contact tracing if and when a case actually occurs? and what assurance can we give our congregation that that procedure will be implemented rapidly and effectively?
So I think there's two parts to that. Once a person is identified who's attended your service, and the contact person at St. John's gives the information to HHS, they would take the contact tracing from there forward, because that person who was identified probably told HHS themselves or was identified by a doctor, and they began the process. What would be most helpful on the other side, so if that's the HHS side, on the other side, what would be most helpful is that you document safely, while protecting people's privacy and things like that, who was at each service. So while we didn't have a specific method, a few thoughts were floated around. That as a cohort, if you used to have 2 services, maybe you now have 5 services. And in one service, you have a certain set of documented people that if they come on the worship day, let's say it's a Sunday, that they always come to the 8 o'clock. You clean in between. So if the person identified came to the 8 o'clock and not the 10 or the 12 service, you would then be able to say to Marin HHS, when they called your site-specific lead person, and that's in the form, when they called your person, oh, this is the cohort of people who were there. Now, you might not know who the person who was infected sat by, but you would know that these 20 people were there within that 14-day period when the person was infected.
Good. Well, thanks. And I guess the further emphasis is the extent to which Marin HHS will actually have the capacity to provide this very important service in the event that a diagnosis of COVID-19 is made. Where it's a large county, there are a lot of places where this could occur. And in a time of rising cases, when that should occur, demand might be substantial.
Yes, I think you're right. And they're certainly building that capacity. And so my role as the facilitator of this faith-based working group was actually a disaster service role, since my core role is as an assistant director of the library system. So there are a number of staff across departments who've been trained in health information privacy. I think about 40 right now, staff who aren't traditionally contact tracers or necessarily working in HHS at all, who are a part of that cohort. And they continue to bring in more and more people to build that capacity. But we do have to kind of meet them with solid information so they can take their next steps.
Well, thanks very much. That's very helpful.
Oh, you're welcome.
I think Dave is next. Pastor Dave Miller, there you go. Dave, you want to unmute yourself? I think you're still
There I am. I'm sorry about that. I'm currently driving, so I wanted to be in safe driver mode.
No problem. Be safe.
Question, comment. We've been looking at the Marin Recovers page, and we've been doing so to prepare our own plan as a council, as a worship council. And we've been doing a pretty good job of sharing ideas, and we relied heavily on the work that you guys have done. So thank you very much for letting us do that. And as we're preparing, we're starting to see that our worship service will not look as worshipful as it had in the past because of these changes. And also, we've been having a lot of success on digital platforms like Zoom. So we're content to wait out this set of parameters if we think that the next set will be a little less separate-y, I guess is the word I would use. And look forward to the next set of parameters that allow us to do a little bit more. Can you give us any kind of estimated timeline? I'm sorry if I'm asking this question and it's already been asked. I got cut out a second ago.
Yeah.
So is there an estimated time of when another set of regulations might be coming out?
Honestly, I do not know. And we struggled a lot with that. Not struggle, but we talked a lot about what do we know? What can we guess? And ultimately, it'll be based on the number of infections and the number of hospitalizations. So when Dr. Willis talks about it, he mentions that in part, we had a spike a few weeks ago, late May, early June, because we increased our testing capacity. So in a commiserate way, you get more, you identify more infection when you test more. Though hospitalizations and deaths are also important indicators, and the arc of the increase has not been as steep as you might predict, given that we had a jump in cases, but we haven't had we've had more, but not a significant arc on the line, on the trend line, around hospitalizations and deaths. So California is surging, but it's a little bit more Southern California right now. So based on the data, they will take a look at easing more restrictions. I don't know that it'll be soon, and they do it in 2-week blocks. So even if we got really good information today, we were allowed on June 6th, so we probably wouldn't be open until another, till the 20th or the 21st, or around those 14 days more. And so the waves happen like that. It's sort of where the data lands.
Yeah, that's very helpful. Thank you very much.
Oh, glad to help. I wish I had more information.
No, just the 2-week period. We can let our people know that we're taking things as they come in 2-week waves. And right now, these are the recommendations. And if we wanted to meet, it would have to be outside with all these provisions. And we're a smaller congregation. So, I mean, small meaning 50 to 60. I don't know if that's small anymore, but we're definitely ready to wait, continue our celebrations on Zoom, and continue to keep each other safe that way.
I think that's a very wise choice.
That was the top recommendation that you had on the Marin Recovers was if you can keep meeting on Zoom or digital platforms. And we're like, okay.
Yeah.
All right. Thank you, Dave. Pat, I see you have your hand up. If you unmute yourself and please ask your question.
Okay. I wanted to just go back just a little bit about the renters to your church. And we do have 2 congregations that also rent space from us on, different times. And then, but did I hear you correctly that when you have people like that, groups like that, they make out their own site-specific protection plan?
Yes, under your general supervision, so that if the primary, owner of the property and the primary controller of the space, you would have one plan, and then they would create a plan for the time that they're using your space. They need to coordinate, but they would create their own plan with their own point person.
Okay, and that would go, we also have a nursery school, and they would do the same thing.
And I believe childcare and summer camps are open with very strict rules. So they would follow if they were a summer camp, that format, they would follow the summer camp and childcare rules. So in some ways, we think of all of these components as part of our faith-based institutions. But one of the ways we talked about it in the work group is that churches and faith-based institutions in general run several lines of business. you run an office, you run a food service, you run you run a rental space. So make sure that you're crossing your guidelines with that line of business's specific guidelines. So for example, Spirit Rock actually has a hotel for all intensive purposes on its property. So while it's a faith-based institution, it has to look at, for overnight guests, the hoteling component of the Marin Recover site.
Thank you.
And I just put both of those in chat. I put the link to summer camps, childcare, and then hotels, hospitality. I just put those in the chat, those links. So who else has a question? Sharon?
Yeah, I wanted to ask again about the outdoor services. Would it be all right to put up canopies with open sides?
You know, I think that would still count as outdoor, the circulation of air, but you want to think about, still people need to be 6 feet distance. You still probably want to do cohorts. You want to mark those spaces, have families sitting together, and the amount of space. So I could see a scenario in which someone said, you know, some of our more vulnerable community members would do better under a tent. Okay, that could make a lot of sense, but what would the square footage of that covering need to be to put everyone under it? Or would you say there are 4 or 5 people who are sun sensitive or tiny babies, and they're going to be under this very large space?
Okay, thank you.
And if I could just say a word about that, in general, about outdoor services. One thing, if this is helpful, Khadija Hensia Gibson, who's one of our board members at Islamic Center of Mill Valley, they had a gathering for the ending of Ramadan. And what they did is they had a space, and they had someone who was essentially an usher, a gatekeeper, who would greet people, again at a safe distance, and say, who all in your family group, okay. And they had little cones or pylons out, or some markers. And it was marked out so each group would be distant from the other. And then the guy, okay, go to that pylon there, then the next one, then the next one, then the next one, then the next one, the next one, the next one, and would guide people where to go, with people invited to bring blankets or chairs, folding chairs to sit on, bring their own. And then once everybody was in their place, when it was concluded, then they dismissed everyone in reverse fashion. So the last one to come at that back pylon, they left first, and then invite the next group. That way people aren't intermingling as they leave. So that gave me a picture for how one group did it in a safe fashion. So just wanted to offer that as a possibility.
And as opposed to, you know, and I would also say, as opposed to maybe one big tent, maybe if there are a few vulnerable people, you have a small strip of a tent that, you know, covers them. Maybe some people bring umbrellas and they sit in spaces that are already marked and further back. But to the extent that we can think about whatever the challenge is, you know, maybe too much sun on a person, if we can come up with 2 or 3 solutions and then choose the one that is most safe and helps to meet the need.
Dave, it looks like you have a question again. Go for it.
I do, yes. The first was, I actually, as we were talking, I had one, but then as I was hearing about the canopies and umbrellas, I had another point. Is that something we would bring ourselves, or have our people bring themselves, which would then be another point of possible contact of spread?
So optimally, if people could bring their own equipment and take it with them, that would make sense. I think if, though, it's an equity issue, so not everyone has folding chairs at home, and you don't want people to have to go out and buy a $20 or $50 folding chair. I haven't bought a folding chair in a long time, so I don't know. But you know, you don't want people to have to incur cost if you're a part of a population for whom that would be challenging. So we do want to keep economic equity, racial equity, all those things in mind as we move towards our faith-based celebration.
And then the other question I had was about the preschools opening, and we've been open. All Saints' preschool and children's center has been open this whole time with limited staff and with limited hours, and trying to keep ourselves afloat while still providing the essential service for the workers that really have their stuff to do. But my question is, the county has issued some very strict rules for the preschool, and the state has a lighter set of those rules, and we're just finding it difficult to serve two masters, as one can imagine. Whom should we prioritize serving?
The County of Marin Public Health Officer is in charge.
Thank you, that helps. That's it, that's all I got.
Yeah, no problem. And we cannot be more relaxed than the state, but counties do have the ability to be, based on the data, more strict,
Sure.
for lack of a better term.
No, that's what it's becoming. That's what it's becoming for our staff and for what we have. It's starting to get problematic. We don't have enough room to put more families that are coming in now that they're going back to work. Parents are going back to work. So while we have 20, 25 now, we're anticipating 70 to 80 when we're back to full strength. And that's going to be problematic to try and put only 10 in a room with teacher.
Yes, I think that you're right. And some of those conversations are happening about the current cost of childcare, about space for childcare, the ability of adults to go back to work, about the licensing needed, because children's spaces at that age group are licensed. But I do recommend that you use some of the contact features that are on the Marin Recover site to raise your voice, and also to connect with, and just share your experience, and also connect with the Child Care Council, because I know that they're a part of those conversations also, and may be able to help.
Will do. I talked to the board today, so I will do that. Thank you.
Bev and then Kent.
Thank you so much. Thank you, Scott, and thank you, Chantel. This is really helpful. Thank you, colleagues. So Corin Grubb is on too. She's our worship elder at Sleepy Hollow Presbyterian. And so we have studied the state of California Public Health and Cal OSHA report, and recognize that as a church we're serving our congregation, but we also have employees, and we have a duty to them, which we understand is a little higher vigilance even, because it seems like we have to take temperatures for the employees, but not for attendees to an outdoor service, we think. We've also studied the 23 requirements from Dr. Matt Willis for the county, and we do understand that what he said is that in the case that there's a variance between what the state of California and the county of Marin are requiring, pick the stricter rule.
Yeah.
So we get all that, right? So, so it's very difficult to digest it all and keep it all in mind. So I'm interested to hear from Scott Quinn that the Mill Valley Mosque did indeed have an outdoor celebration, because we are thinking at Sleepy Hollow, we're blessed. We do have a beautiful outdoor space. We have a lot of outdoor space. And so, and our Zoom worship, we have done 13 weeks of Sunday Zoom worship, and it's been very successful. But the young families with the little children are just checked out now. They're trying to do school and whatever. They're not coming on Sunday morning anymore. The rest of our congregation, including their family from around the world, is coming on Sunday morning. The families with the little kids not, So we've been feeling very motivated to try to serve the young families to maybe have an outdoor service now that it is allowed if you have enough space and you can follow the 23 rules plus the state, public health and Cal OSHA.
Yeah.
Okay,
Sure.
I feel Dave, I guess that's my colleague, Pastor Dave, point about, I mean, when you go down the 23 rules from Dr. Willis, it's basically like, yes, you can have church outside, but you cannot touch each other. You cannot have hymn books. You cannot have communion. You cannot serve coffee. You can, it's like everything that we like to do, we can't do, it sort of looks like. So then it can feel sort of bleak, but it sounds like the mosque did something that worked. I'm wondering if Scott or any of you know if anybody else has done anything outside since it was allowed June 6th with whatever success or failure or to report, because we do have really a thought that we might try to, we'll just try it and have an outdoor service on June 28th and live stream it. Corinne Grubb, bless her, she's on here somewhere. She and her husband have put in a huge amount of effort into figuring out how we can live stream and film outside the church. So we would continue to Zoom for the people that don't want to come out of their house or are vulnerable, etc. But maybe the families of young children would want to come. However, keeping them in their pod or else doing those strict preschool childcare rules is an interesting, I'll just call it a challenge. But if anybody has any experience on doing anything outside yet that involved children or youth, or Chantel, if you have any wisdom on that, we just, basically we have to follow those childcare summer camp guidelines and keep the kids with their parents.
If kids are with parents, they need to, yes, they have to be with their adult. I think the broad stroke guidelines are have as much circulating air as possible and minimize the close contact so that the intensity and likelihood of transfer isn't there. Still wearing masks, which is hard for younger children, but there's an age limit for masks, and then with their parents. Their parents really need to help make them comfortable. But, as Scott said, the cones, or I've seen in San Francisco parks, massive circles. I don't know what the circumference was, but a whole family or person sits in the circle. And then there's a lot of space between the circles. You could have a circle of rocks or cones, or some people painted on the grass, but I can absolutely understand why you would want to do both. And parents would need to follow the rules with their young children.
Thank you.
And I think you were next.
Wanted to take advantage of having Chantel Walker here just to get some opinions here. I'm always a little worried about this. What we've been doing, we've been allowing about 8 or 10 people to come on Sunday morning. All with masks, we got the sanitizer. We've far distance, about double the distance. Nobody sings except for my wife and I, and we're way back away from people. What I get worried about is just people walking in that we have no control over the situation. It's happened a few times, and sometimes when we're about halfway into the service, all of a sudden 2 or 3 people walk in. We have a guy at the back that has the mask and the sanitizer and so on. But it makes me a little nervous when I see that. And my wife looks at me and I look at her and I think, what are we going to do about this situation? Because we open the doors, so we got the ventilation in the windows and we feel it's pretty safe. We do online, we've been filming our service for long time. I just wanted to get your opinion, Chantel, about what do you do about the people that just walk in that
I think I hear you saying a couple of things, and the only thing right now that is allowable in the health order is outdoors.
Okay.
So that's a key thing to think about. The other piece of that is we did have conversations in the working group about sometimes the difficulty, but sometimes the lack of desirability of stopping people from coming into a house of worship.
Okay.
So I think you're doing sort of from the site-specific plan perspective, having a designated person that kind of does crowd control, membership control, whatever, it makes sense to call that, is the right thing to do. Being outside is also what's allowed. And in some ways, it's either temperature taking, which is suggested. I don't know if it's required, but it's suggested. Masks are absolutely required. So I do think it's possible to say that if someone is not going to wear the mask, that would be a violation, right, of the space. That said, I'm not a healthcare professional. And mostly I've collected information and done a lot of reading. I think I was joking with Scott, or maybe the whole working group, and saying, maybe my second master's should actually be in divinity, given all the things that I'm learning. Like that's what I should study now. But I think that it's a challenge. The human part's a challenge. And for some people, it doesn't even feel right to restrict unknown individuals from being a part of it.
Thank you.
I will have to go to a 2:00 meeting in just a moment. Is it possible that Scott and I could follow up on any unanswered questions? Although Scott knows a lot, he was there every step of the way and a key sharer of information.
Sure, I'm happy to stay on, Chantel, and just answer what I can, and anything I can't, we'll take down the question and we'll facilitate an answer. Thank you so much for joining us today and being with us. And
great to be here with you. Yeah, and I look forward, just for the record, to when we can be together more in our congregations. I do think that's going to be a while. So.
And whenever we have that new set of protocols, would you be willing to join us again for?
Absolutely.
Fantastic.
Absolutely.
Thank you so much for being with us
Thank
today.
you, Chantel.
Thank you.
Thank you.
And anyone who wishes, you're welcome to stay, and I'll hang out here and answer any questions, but I know some of you probably need to go on to other things, and thank you for joining us, and blessings to you. All right, well, let's continue with questions. I think Darwin, I think you had a question.
Yeah, thanks very much. The value of shared experience is very high, and I'm wondering whether there's a provision or a mechanism through which we can share experience as we move forward. What is working? Where are there obstacles or problems? Whether this could take the form of a frequently asked questions format, or otherwise calling attention to special lessons learned along the way. We have a lot to learn from each other, and it would be a shame not to be able to take advantage of that if people are willing to contribute from their experience.
Yeah, I will bring that up to our faith-based organization committee working group meets tomorrow. So I'll bring that up tomorrow. I know that 2 congregations were looking at creating who are on the committee, are looking at creating I think probably a Google Drive, where they were going to start posting their experience and what they've learned and questions they have. So I will bring that up tomorrow and see what the best logistical way is to do that.
Great, that'd be very helpful. Thank you.
Who else? Anybody else have a question? I don't see any other hands. And you can always just unmute yourself if you have a question. Anybody else? All right. Oh, Kenny, did you have your hand up? No. Okay. Well, let's close with unless anybody has a final. No? Very good. Well, let's close with one final blessing. And once again, from our friend, John O'Donohue. I invite you just to receive this as a blessing during this time. For the interim time. When near the end of day, life has drained out of light, and it is too soon for the mind of night to have darkened things. No place looks like itself. Loss of outline makes everything look strangely in between, unsure of what has been or what might come. In this light, even trees seem groundless. In a while, it will be night, but nothing here seems to believe the relief of dark. You are in this time of the interim, where everything seems withheld. The path you took to get here has washed out. The way forward is still concealed from you. The old is not old enough to have died away. The new is still too young to be born. You cannot lay claim to anything in this place of dusk. Your eyes are blurred and there is no mirror. Everyone else has lost sight of your heart and you can see nowhere to put your trust, yet you know you have to make your way through. As far as you can, hold your confidence. Do not allow your confusion to squander this call which is loosening your roots in false ground, that you might come free from all you have outgrown. What is being transfigured here is your mind, and it is difficult and slow to become new. The more faithfully you can endure here, the more refined your heart will become for your arrival in the new dawn. Thank you, dear ones, for joining us today.